Welcome to Keeping You in the Know in 2023. As part of our LCI lecture series, today our presentation will be on successful sleep. We're going to learn the tools to manage insomnia. We're very grateful to have you all with us today and to learn from our very own social worker, Elsa Rayner. She will be educating us, as I said, on successful sleep, a topic that I know is near and dear to all of us. At the Lynn Cancer Institute, we believe that education, prevention, screening and early detection, a variety of treatment options, the expertise of our staff, and our latest technology will truly save lives. In the interest of time, Elsa's bio was sent to you by email. During her presentation, we invite you to please take notes. And if you have any questions or comments, please write them in the Q&A or the chat box, because she will not be able to see you or hear you during her presentation. And there will be time at the end for your questions to be answered. We're happy to welcome you today and to introduce our oncology social worker, Elsa Rayner. Elsa?
Thank you so much, Jan. Good morning to everyone and welcome to today's presentation, Successful Sleep Tools to Manage Insomnia. My name is Elsa Rayner, and as my role as a social worker, I can confirm that so many of our patients identify having sleep concerns primarily related to poor sleep or to what they believe to be insomnia. Many go to their doctors for help, and at times, a prescription for sleep medication is warranted. But there are also other tools that can help, either in conjunction with medication or using these tools on their own. I hope that if you have gone to a medical professional, that this wasn't your experience. But there is truth in this cartoon. Insomnia is very common. In fact, 40 million Americans experience insomnia annually. Globally, insufficient sleep is prevalent across various age groups and is considered a public health epidemic that is often unrecognized and underreported, which means that there may be more than 40 million that is suffering from insomnia. In addition, studies are showing that the increased use of smartphones and electronic devices is worsening the epidemic. So I am hoping that today's presentation will shed some light on insomnia and provide a few tips on how you can improve your sleep. My one and only disclaimer for today is that this presentation is for informational and educational purposes only. It does not substitute professional medical advice or consultation with a healthcare professional. The goal of today's presentation is to give an overview of sleep, insomnia, and to review techniques to help combat insomnia. We're going to focus on the non-medical approaches of insomnia, emphasizing the benefits of what is called cognitive behavioral therapy for insomnia, or CBTI, and explore emotions, thoughts, and behaviors as they relate to sleep. Also, a few mindfulness and relaxation techniques which can help with sleep will be demonstrated. And I truly encourage and hope that you will integrate them into your daily routine. So today we will review sleep cycles, what is insomnia causes, facts and symptoms, insomnia and cancer, cognitive behavioral therapy for insomnia, how our thoughts impact our sleep, cognitive restructuring, and review sleep hygiene. But before we get into our presentation, let's take a moment to test your knowledge about insomnia and sleep with some true and false questions. So there's no need for a pen and paper. We will review these together one by one, and more detailed explanations will be reviewed throughout the presentation. So the first one is true or false. We spend approximately 1/3 of our lives asleep. Well, the answer to this is true. The average person spends about 26 years sleeping in their life, which equates to 9,490 days. Number 2, watching television while I fall asleep is a good way to ensure a solid night of rest. This is false. If I am tossing and turning, I should get out of bed. This is actually true. If I can't sleep, I should check my email or play a game on my tablet or phone. This is false. Everyone dreams while they are sleeping. This is true. You may not remember your dreams, but everyone has approximately 3 to 6 dreams per night, and dreams can occur anytime during sleep, but they are most vivid during the stage of sleep called REM sleep, or rapid eye movement. Number 6, sleep is important for my physical and mental health. Well, of course, this is true. Number 7, going to bed earlier and sleeping in over the weekends is a good way to catch up on sleep. False. Insomnia is more frequent among women and the elderly. So this is true. So why women? There isn't a definitive answer. It may be that women are more likely or willing to acknowledge that they experience insomnia. Also, especially for middle-aged women, hormonal changes may precipitate insomnia. And for the elderly, this may be perhaps the medications or chronic pain or sleep disorders like sleep apnea or restless leg syndrome. Number 9, the room should be warm and light when I sleep. This is false. For optimal sleep, your room should be cool and dark. So the temperature of the room may vary from person to person, but most doctors recommend keeping the thermostat set between 60 and 68 degrees for the most comfortable sleep. And lastly, alcohol before bed improves sleep. This is false. So I'm not sure how everyone did on this little quiz, but I'm guessing that many of you knew the correct answers. But the bigger question is, how many of us still do what we know is not the best choice when we're having difficulty falling asleep, like falling asleep with the television on or going on our phones or our tablets while we're trying to fall asleep, and especially trying to catch up on sleep perhaps over the weekend. If you do these things, do not worry, you're not alone. So we're going to explore a little bit about sleep. What is sleep? So sleep is a state of reduced mental and physical activity in which consciousness is altered and sensory activity is inhibited. During sleep, your muscle activity is decreased and interactions with the surrounding environment are significantly reduced. Sleep is divided into cycles, and the cycles are divided into stages. So I'm guessing that many of you have heard a lot about the stages of sleep. But let's just take a second to look into sleep cycles. What are sleep cycles? So this is a physiological process that occurs during sleep. It allows the brain and the body to perform housekeeping functions like repairing or growing tissues, removing toxins, and processing memories. So generally, when we think of a full night's sleep, we tend to think of it as continuous, uninterrupted rest. But that's not the case because we just learned that sleep consists of these 4 to 6 cycles. Each cycle is approximately 90 minutes, and within those 90 minutes are the 4 separate sleep stages. So you can sometimes wake up briefly in between cycles, and some of you may even be aware of being awake in between these cycles. But if you are aware, you may wake up in the morning and think, oh my gosh, I was up 3 times last night or 4 times last night, and begin to focus on this thought, which can begin to alter your thought process regarding your sleep. And we're going to talk a little bit more into how thoughts can affect our sleep a little bit later on. But before we do, next, let's look at the stages of sleep. So here are the stages of sleep. You can take a look at this, this graphic. Stage 1 is when you first drift off to sleep. Stage 2, your body temperature drops and your heart rate begins to slow as you fall deeper into sleep. Stage 3, your muscles relax, your blood pressure and your breathing slows, and this is when your deepest sleep occurs. Lastly, stage 4, or REM sleep, rapid eye movement sleep, is when dreams occur. So now that we have reviewed sleep, sleep cycles, and the stages, we're going to start to dive into insomnia, but I do want to take a moment and review a technique that can help you wind down and prepare for sleep. and it is called progressive muscle relaxation. So we're going to do this technique together in a moment, but just to give you a background about this progressive muscle relaxation, I want to tell you that it is a method of reducing physical and mental tension by alternately tensing and relaxing different muscle groups. It was developed in the 1920s, and it's based on the idea that if you relax your body, then you can also relax your mind. It involves tensing and releasing each muscle group, starting from your head and moving down to the toes while breathing deeply and calmly. It can have many benefits for health and well-being, including help with insomnia. You can do this exercise sitting in a chair and, of course, while lying in bed. So make yourself comfortable and let's do this together.
Progressive muscle relaxation. Learning how to deal with stress is a necessary part of life. Everyone deals with stress differently, so finding what works for you is important. Ready to try progressive muscle relaxation? We'll walk you through this easy, stress-relieving activity. Progressive muscle relaxation helps you relax your mind, relax your body, reduce tension, focus your mind, and calm you down. Here's how it works. Tense each muscle group. Hold the tension for 5 seconds. Release the tension. Feel the muscle relax. Try to visualize the muscle tensing and relaxing. Remember to keep breathing deeply through the exercise. Try to focus hard on each step. If your mind begins to wander, bring it back to the muscle you are working on. Let's start with your head. Close and tighten your eyes. Tense all muscles in your cheeks. Tighten all the muscles around your lips. And press your tongue to the roof of your mouth. Hold that tension for 5, 4, 3, 2, 1. Quickly release and relax. Now your shoulders, chest, and back. Raise your shoulders to your ears. Tense your back by pulling your shoulders back. Hold that tension for 5, 4, 3, 2, 1. Quickly release and relax. On to your hands, fingers, and arms. Bend your wrist and tighten your hands into your fist. Flex your biceps. Hold that tension for 5, 4, 3, 2, 1. Quickly release and relax. Now for your belly. Pull your belly button in and tense all the muscles in your stomach. Hold that tension for 5, 4, 3, 2, 1. Quickly release and relax. Moving on to your legs and your feet. Tighten your thighs by pressing your knees together. Pull your toes towards you and feel the tension in your calves, thighs, and feet. Hold that tension for 5, 4, 3, 2, 1. Quickly release and relax. Breathe deeply and imagine a peaceful sensation flowing from your head, down your neck, into your chest, legs, and settling into the soles of your feet. Repeat this process when necessary until you feel calm and peaceful.
Okay, so I hope everyone is awake. Now we're going to talk about insomnia. So what is insomnia? Insomnia is defined as a complaint of difficulty falling or staying asleep, which is associated with significant distress or impairment in daytime function and occurs despite an adequate opportunity for sleep. So there are several criteria to be officially diagnosed with an insomnia disorder, but some of the core components include difficulty falling asleep, difficulty staying asleep, and early morning awakening. Insomnia is not defined by the number of hours of sleep, but rather by an individual's ability to sleep long enough to feel healthy and alert during the day. So what are some of the causes of insomnia? So there are many different factors. I've listed some examples. Physical discomfort, whether it being too hot or too cold, lighting, noise, being in new surroundings, working different time shifts, stressful life situations, a divorce, a death of a loved one, an illness, losing a job, substance use of both illicit and non-illicit, like cigarettes, alcohol, caffeine, or illegal substances, and jet lag. Now, some of these factors may be short-term, like jet lag, so therefore, insomnia may resolve when this underlying factor is removed or corrected. So these are the causes, and now we're going to move into the common symptoms of insomnia. So the common symptoms include daytime fatigue, daytime sleepiness, mood changes, poor attention and concentration, lack of energy, anxiety, poor social function, headaches, or increased errors and mistakes. Remember that impaired daytime functioning is one of the core components of insomnia, so it's a very individualized experience. And just as a review, here are some insomnia facts. So take a look at this graphic. Some of these facts have already been discussed. Again, insomnia is the most common sleep disorder in the United States, affecting about 40 million Americans each year. And for insomnia to be considered a chronic condition, you must experience it at least 3 nights a week for at least 3 months. So before we continue, I want to talk a little bit about sleep issues and cancer. So sleep disorders are common in people with cancer. As many as half of patients with cancer have problems sleeping. So there are many reasons a cancer patient may have trouble. I've listed some, of course, stress about having cancer, physical changes caused by the diagnosis, perhaps surgery, side effects of medications and other treatments, being in the hospital. And there also may be just some health problems overall that are not related to cancer. But if you're going through cancer treatment and have sleep disturbances, please speak with your medical team and you can ask them, could these sleep problems that I'm experiencing now be a side effect of my diagnosis or perhaps my treatment medications or my treatment plan? You can also ask if the sleep disturbance will resolve once your treatment is completed. And something else that is really important to emphasize, and not just with cancer patients, is that sleep does change as we age. So although you might find you are sleeping less as the years pass, this does not automatically equate to having insomnia. So as you can see, the amount of recommended sleep decreases as we age. Also note that there is a wide range of what is considered appropriate hours of sleep. So this chart starts from newborn all the way up to an older adult. And I'm going to kind of focus more on the end of this particular chart. For an adult, that's anywhere from 26 to 64 years, or an older adult, which is 65 plus years. The recommended range of hours is that 7 to 9 for an adult or 7 to 8 for an older adult. But then there's also appropriate range of hours of sleep. And this is anywhere from 6 to 10 hours for an adult or 5 to 9 for an older adult. So there seems to be a common belief that all adults need a full 8 to 10 hours of sleep each night, and that's just not the case. So some adults and older adults function just fine on as little as 5 to 6 hours. So we reviewed lots of facts, causes, and symptoms of insomnia, but what can you exactly do to help with poor sleep? So this is where cognitive behavioral therapy may come in, and this may be an option for you. Cognitive behavioral therapy for insomnia, or what's called CBTI, is a non-medical approach that explores emotions, thoughts, and behaviors as they relate to sleep. So CBTI is a growing field to help treat insomnia, and its focus is on changing the way you think, behave, and feel towards sleep. So part of this technique is learning how to gain control of your thoughts. And I think we can all agree that gaining control of your thoughts can be easier said than done. I did find a really short video that I think does a fantastic job of breaking it down into bite-sized pieces.
Training the mind is often quite different to how people imagine it to be. Maybe they have an idea it's about stopping thoughts or eliminating feelings, but the reality is a bit different. An easy way to think of it is to imagine yourself sitting on the side of a busy road, the passing cars representing the thoughts and the feelings. All you have to do is to sit there and watch the cars. Sounds easy, right? But what usually happens is that we feel a bit unsettled by the movement of the traffic. So we run out into the road and try and stop the cars, or maybe even chase after a few, forgetting that the idea was to just sit here. And of course, all of this running around only adds to the feeling of restlessness in the mind. So training the mind is about changing our relationship with the passing thoughts and feelings, learning how to view them with a little more perspective. And when we do this, we naturally find a place of calm. But we sometimes forget the idea of the exercise and become distracted? Of course we will. But as soon as we remember, here we are, back on the side of the road again, just watching the traffic go by, perfectly at ease in both body and mind.
Okay, so I really hope you enjoyed that. I really think that the biggest takeaway from this video is if we can focus on what the goal is, right? When we think about our thoughts, our goal is to change our relationship with them and learn how to view them with a little bit more perspective. So let's take a deeper look into how our thoughts affect our sleep. So some of the most common thought patterns that can affect sleep are jumping to conclusions, should, must statements, and all or nothing thinking. And as we go through these common thought patterns, you may find that they can translate into areas of your life other than just sleeping. So, jumping to conclusions. This occurs when you use information about a current situation to predict what the future will hold. Often jumping to conclusions entails making predictions that are rigid and extreme, match the tone and intensity of your emotions at the time you are making the prediction. These thoughts are distorted, negative, and acute. So an example of jumping to conclusions would be, I'm having trouble sleeping tonight, so now I won't be productive at all tomorrow. Should and must statements. These statements imply that there are rules or expectations about how our body is to function, which have not been met, and therefore elicit within us feelings of frustration and anxiety. Some should-must statements about sleep can be, I should be asleep by now, or I must be asleep by a certain time to have a good day tomorrow. And lastly, all or nothing thinking. This involves drawing extreme conclusions about a situation without leaving space for ambiguity or alternative explanations. So an example of all or nothing thinking can be, I won't get any sleep tonight, after having just a little bit of difficulty dozing off to sleep. So these thoughts can develop into a negative mindset towards sleep and develop into what is called automatic negative sleep thoughts, or NSTs. But here are a few. So you may be able to relate to some of them. Perhaps you have your own negative sleep thoughts, but some of them are, I didn't sleep a wink last night. I must get a full 8 hours of sleep. I'm dreading bedtime. I know I won't sleep well tonight. It's going to take me forever to fall asleep. Sleep is very difficult for me. So you're getting the idea, right? So negative sleep thoughts have a powerful effect on making you feel anxious and frustrated. And in turn, these negative emotions mobilize the stress response, which increases your heart rate, your blood pressure, your muscle tension, and breathing rate, and it speeds up your brain waves. The stress response then activates your brain's wakefulness system and weakens the sleep system. These thoughts occur almost automatically. It's like a knee-jerk reaction, so that you're not always aware of them or their negative impact on your sleep. Remember that these thoughts are often inaccurate and distorted. Now, each of these thoughts is based on a partial truth that your mind is exaggerating. And it can be hard to push back on these thoughts, especially when you're panicked about falling asleep. So the first step is to identify what your negative sleep thoughts are, and then learn how to challenge them. So how do you do this? So I'm going to tell you that this does require a little bit of effort, but for a good night's sleep, it certainly can be worth it. So I'm suggesting to place a pen and a paper at your bedside. And when you can't fall asleep and your mind starts to work, take a few moments to jot down your thoughts. Don't try to analyze the thought, just write it down. The next day, choose just one of those thoughts and take a closer look at it. And you ask yourself, what is the evidence that supports this thought? Is there any evidence that doesn't support it? Chances are you're going to discover that there's some inaccuracies in the thought about sleep. After practicing during the day, begin to challenge your thoughts in real time as you lie in bed, prepared to sleep. So here's an example of challenging a negative sleep thought. So you can change your negative sleep thought by something that is called cognitive restructuring, which simply means to change your thoughts. Before you can change them, you must challenge them and almost deconstruct your thought. So you're having a difficult time falling asleep, and the thought that comes up is, tomorrow is going to be a disaster if I don't fall asleep soon. So ask yourself, what is the evidence to support this thought? Well, on days I've slept badly, I've tended to be somewhat irritable. True. I'm not always as sharp at work after a night like this. Also true. But now ask yourself, what is evidence that doesn't support it? I can't think of any times I haven't been able to get through the day. I'm usually surprised that things are basically okay. I've been able to function well on less sleep. Next is to analyze how accurate was this thought. So we've already established, yes, there is a kernel of truth to it. I don't tend to thrive after a poor night's sleep, but it's never been as bad as I fear it will be. So the next step is to replace it with a more truthful or accurate thought. Some suggestions are, if I sleep badly tonight, tomorrow may be a struggle at times. I've had hundreds of bad nights where I worried about the next day, and so far there haven't been any true disasters. Based on experience, I'll still be able to function tomorrow, even if I'm not at my best. And the next slide have some even more negative sleep thoughts that were challenged and rephrased into something more positive. And I want to say that by recognizing and replacing your negative sleep thoughts with more accurate positive thoughts about sleep, you'll be less anxious and frustrated about insomnia. And as a result, you will sleep better. So keep in mind that this is not the same as denying insomnia. Cognitive restructuring means to think about insomnia in a less negative and distorted way. So there's some examples of a negative thought converted into something that is more positive. I don't think I can fall back asleep. I have been able to fall back asleep before. My insomnia is getting worse. My sleep is improving. I need more sleep. I can get enough sleep. And again, this will be very personal to each of you. It can also be helpful to do the progressive muscle relaxation exercise that we watched at the beginning of this presentation, and then focus on your new positive thought. So now we're going to look at something about sleep hygiene. So what is sleep hygiene? It's one of the components of non-medical treatments for insomnia, and it includes steps that may improve initiation and maintenance for sleep. And I listed some of the following strategies: sleep to feel rested, and then get out of bed. Don't oversleep. Don't lie in bed just to relax. Bed is for sleeping. Maintain a regular sleep schedule. Don't force yourself to sleep. Don't drink caffeinated beverages in the afternoon or the evening. Don't drink alcohol prior to going to bed. Nicotine products is not a good idea before sleeping. Adjust the bedroom environment to induce sleep. As we mentioned earlier, dark and cool. Don't go to bed hungry. And try to resolve stress and anxiety before going to bed. When you really think about it, sleep hygiene really is just focusing on building habits. When you incorporate sleep hygiene into your routine, you begin to build habits that will help you sleep better. And so here are some suggestions to help you improve your sleep habits. Go to bed and wake up the same time every day, even on the weekends, even if you didn't get enough sleep, because you're beginning to train your body to sleep at night. Develop a bedtime routine. Do the same thing every night before going to sleep. So for some, it may be taking a warm bath, reading for 10 minutes before going to bed, because you're going to begin to connect the activities with going to sleep. and doing them will help you feel sleepy. Use the bedroom only for sleeping or having sex. Don't eat, talk on the phone, or watch TV while you're in bed. Make sure your bedroom is quiet and dark. You can use a fan or white noise. I'm going to show you some apps later that you may be able to block out any noise or help to relax. If you're still awake after trying to fall asleep for 30 minutes, the suggestion is to get up, get out of bed, and go to another room. Sit quietly for about 20 minutes before going back to bed. And you need to do this as many times as you need until you can fall back asleep. So I have some more tips to help you sleep. Exercise regularly, but avoid vigorous exercise within a few hours before going to bed. Find ways to reduce or manage the stress in your life. Don't lie in bed worrying about things. You can try to set aside another time for just worrying. Perhaps spend 30 minutes after dinner writing down what's worrying you and what you can do about it. The goal is to associate your bed with sleep, not worry. Try eating a light snack before going to bed. It's not suggested to eat too much right before bedtime, though. So a glass of warm milk or maybe some cheese and crackers may be all that you need. Don't nap during the day if naps seem to make your insomnia worse. Again, this is individualized. It's different for every person. Certainly, for some, taking a nap can be refreshing and restorative, especially if you're sleep deprived or feeling tired from treatment. But listen to your body. The general recommendation for taking a nap is that it lasts no more than 20 minutes and is best taken in the early to mid-afternoon, as taking a nap later in the day can negatively impact your sleep quality and duration. So we've covered quite a bit, and as we're nearing the end of this presentation, I want to emphasize that there is hope. There are tools and techniques to help you overcome sleep issues. I encourage you to try the progressive muscle relaxation and to be aware of your thoughts. Challenge and replace the negative ones. And although going on your smartphone is not advised before bedtime, you can use them to access apps that can help with sleep. And here are some of them. Many of these are free. You can upgrade on some of them for a fee, but you may be surprised just how many offer tools at no cost. I particularly love CBTI Coach. I think it's fantastic. It's a free app. It's filled with tons of information and activities. They even have suggestions of what activities you can do if you are having difficulty sleeping and you're in bed for 30 minutes, can't sleep, and you go into another room for 20 minutes. They give suggestions of what to do within that 20 minutes. They read stories to you aloud, almost like a bedtime story, breathing exercises. So I really can't emphasize that one enough. Also, Headspace is fantastic. Headspace is where the Gaining Control of Your Thoughts video we saw earlier came from. And it's actually going to be where our next video about meditation is coming from. So we're going to close with this very short meditation. I know that meditation and mindfulness are really common buzzwords that we've all heard, and perhaps was even recommended for us to try. But many of us, it doesn't come so easily and it can be overwhelming. But this video is short. It's just over a minute, and I think is a really good example of how we can take a quick pause to quiet our minds and relax. So take a deep breath and enjoy.
Hi, and welcome to Headspace. So no matter what's going on in your life right now, no matter how many thoughts are racing around your mind, no matter how the body's feeling, just take a moment to sit down and take a big deep breath, breathing in through the nose and out through the mouth. As you breathe in, a sense of taking in fresh air, the lungs expanding. As you breathe out, a sense of letting go of any stress in the body, in the mind, just feeling the muscles soften and relax. And close your eyes if you'd like to. One more, breathing deeply in through the nose and out through the mouth. And just take a moment to pause, Allow the thoughts to come and go. And then just gently opening the eyes again.
So I hope you found this presentation helpful. Thank you all for being here today.
I just saw that cartoon. Thank you, Elsa. Let's see, there is a couple of things in the chat box, which are comments. Elsa, I don't know if you can see them, but they're all positive comments. Yes, agreed. Although I'm ready for a nap right now, so. Thank you for all the comments. Does anyone have a question about anything that Elsa presented or any of the slides? Oh, Elsa, it looks like you covered everything and it's exactly what the everyone was looking for. Yeah, very helpful. I hope you can see all the comments because they're all beautiful and very appreciative of all the research that you did on this.
Thank you.
I think we can all appreciate how much it's a well-presented information, but all the research and time that goes into putting this together. So Elsa, on top of everything else, thank you so much for this comprehensive presentation. And we'd like everyone to know that this presentation, as well as all of our others, is recorded. My eyes are actually watering. I think I am ready to go to sleep. Are recorded. So if you'd like to look at this again to refresh yourself with any of the good information or the techniques that Elsa shared with us, you can go, Lee, when she sends out her evaluation, will send the link to our website. The comments are still coming in, Elsa. And you can share with family or friends, anyone who you think would also benefit from this. And so I'm thinking by next week, it should be on the website. And when you receive the evaluation, please complete it and send it back to Lee. It's very helpful to us and helps us, if you have any comments, to know any questions that you have or anything, any other education that you're looking forward to. So we appreciate everyone that has joined us today. And we'd like you to know that this Friday, we're going to be having our physician panel presentation, and they will be educating on prostate cancer, this being National Prostate Cancer Awareness Month. And then on September 27th, Marie will be presenting on nutrition and men's health to keep with the theme. And we all know that October is Breast Cancer Month, and we will kick off the month on Friday, October 6th, with our breast cancer panel. We will have 7 physicians, and they'll cover all the information that we need to hear about breast cancer. So we hope that you will join us in the future. Thank you, Elsa. Thank you, everyone, for joining us. And have a great sleep tonight, everyone. Bye-bye.